Welcome, everybody. My name is Isabel Bjork, and I am the CEO of the Foundation to Advance Vascular Cures. I'm really happy to be here. We are here in partnership with the PAD Collaborative, which I am going to tell you a little bit about, and I'm very excited about being active in all of this. Just so you know, for the day, for this session, we are doing welcome and introductions, and then Dr. Michael Conti is going to give an overview and help facilitate the panel. And we have two patients with us, a caregiver with us, another clinician researcher as panelists, and we're going to wrap up with some resources and tips. And then we'll be closing by 5 o'clock Pacific time. So we'll keep it to an hour. I'd like to start by telling you why we're here and how this webinar came about. Again, we're part of the PAD Collaborative, and the PAD Collaborative is committed to awareness raising in the PAD space, which is very closely aligned with the goals of our foundation and our values and our mission. So on the PAD Collaborative, this is facilitated by the AHA and also has a number of organizations that are working in the vascular disease space and the PAD space in particular. And we've all come together in a collaborative way to try to raise awareness and to give information and find solutions. So the collaborative overall is looking at awareness raising, understanding of PAD, preventing complications, addressing health barriers, and improving quality of life for people with the disease. And since September is PAD Awareness Month, we are really happy to be able to start this off with this webinar. And the webinar itself is focused on raising the voices of patients and caregivers. As a foundation, we are committed to raising the voices of patients and caregivers in everything that we do. We support patient-centered research, and we support engagement of patients and research in their own care. And that is fundamental to all the work that we do. We did want to let you know that for your information, the PAD Collaborative has done a great deal of work, and that includes a heat map activation guide. And that identifies areas of high risk and offers resources to anyone advocating for awareness and change surrounding PAD. At the end of this webinar, we have a contact point for us. And if you have any questions about any of the resources that we are offering or talking about here, then please reach out to us and we'll refer you to them. There are too many people who have been involved in putting this together to thank, and so I'm not thanking anybody individually other than our amazing panelists. But I would like to give out a shout out to the Public Awareness Committee and its leadership and membership for their help in putting this together. So on the panel, we have patients Mary and Ray, who are both PAD patients, and they are heavily engaged in patient support platforms and lifestyle change. And they've been working with patients and caregivers for some time now. Kim is also on the panel, and she is a caregiver and an extraordinary advocate for PAD awareness. I will say that as a foundation, we use only first names for patients and caregivers, and that's why we're continuing to do that here. We also have on the panel Dr. Leanna Banyan. She is an associate clinical professor at UCSF. She's in Fresno. She has a passion for working with patients and is dedicated to limb preservation and wellness. She's also the founder of an extraordinary program that we're going to be talking about called Champions, which is the comprehensive heart and multidisciplinary limb preservation outreach networks. It addresses vascular health disparities in underserved communities through pop-up preventative health screening clinics. And that screening includes hypertension, diabetes, high cholesterol, and peripheral artery disease. It also includes a really heavy educational component and outreach component to the community, and research follow-up to improve barriers to prevention and health and healthcare response overall. And Dr. Michael Conti is introducing and facilitating the panel. He is Professor-in-Chief, Division of the Vascular and Endovascular Surgery at UCSF. He is also the Interim Chief, Division of Cardiothoracic Surgery at UCSF. He's the Edwin J. Wiley Chair in Vascular Surgery. He's the co-director of the UCSF Heart and Vascular Center, the co-director of the UCF Center for Limb Preservation, the director of the Vascular Surgery Fellowship and Integrated Residency Programs. He is also the chief medical officer of our foundation, and I'm sure a million other things. And we are very grateful to have him here. The picture that you see here is Dr. Conti with one of our patients who's also on our advisory board, and his commitment to patients is something that is run throughout every comment that we have ever heard about Dr. Conti. And so again, grateful to have you, and I'm turning it over to you now. Thank you.
Great. Thanks, Isabel. I really appreciate that intro, but mostly in this context, I am a vascular surgeon who takes care of lots of patients with vascular disease and talks to lots of patients and their family members over many years. And I'm excited that we've got national organizations finally understanding the magnitude of the problem so that we can help increase public awareness and education. I'm just going to quickly give you the perspective from the physician side of why it's so important that we have patients, their family members, and their caregivers as partners in the treatment of vascular disease and in vascular health in general in our nation. Because as our population is aging and as diabetes continues to rise, we have a growing problem with vascular disease that we all need to address if we're going to make any headway. So some of the important things just to highlight why we're here. Peripheral artery disease, or PAD, is a tough name for most people to say. It's poorly understood, not only by the public, but even by some medical practitioners, including primary care doctors, nurses, and so forth, and even specialists who understand what heart attack and stroke is, but don't necessarily understand exactly what vascular disease or PAD may be. PAD is different than heart disease and stroke, but they are related. But it's different in every way. It's different in how it affects patients' lives. It's different in how we focus the treatments, and it needs different research as well. Importantly, it's a disease that is a long-term disease. It takes many years to develop PAD to the point where somebody actually has symptoms. And we can alter its progress along the way by making positive changes to individual behavior and also by medical therapies. But like any long-term condition, particularly when it has a long period where it's kind of silent and not affecting people, it may be hard to get people to buy in. So compliance with these changes in lifestyle and medications requires education, constant reinforcement with family members and community, and support, because it's not easy to give up certain habits, and it's not easy to necessarily take medications for many years without understanding why. When we as surgeons or doctors interact with patients with PAD, it's often because their symptoms have gotten really bad. And so at that point, there's a lot of focus around solving their pain or solving their problem. And we're trying to give them a lot of information at once, which can be very overwhelming. And so what I'm trying to express is that it can be very challenging for doctors and providers to really do all the education that's really needed to understand the problem and enable patients to take ownership over the disease. I mean, it's critical that patients and their caregivers take ownership, because that's how they feel like they're more in control of their health. There are decisions and choices. There are many treatment options to be made, but we really can't have people meaningfully contribute to those decisions if they haven't fully understood the problem and are not yet having taken ownership. And to do that, we realize that not everybody understands the lingo that they hear in the doctor's office. There may be issues with language. There may be issues with trusting the medical establishment. There are many, many issues that interfere with the way we communicate effectively. So we need other trusted sources of information like this foundation and the PAD Collaborative so that people feel capable of asking the right questions in the doctor's office, making good decisions, and understanding the risks and benefits and what's to be expected. And this gap that I'm talking about in understanding and education that often, it seems like it's happening in a rush when someone's having a problem, really cannot be filled without the patients themselves and their family members and caregivers, and also the community at large. So that's really the summary of the why around what we're doing here through this effort with the PAD Collaborative. We need to spread awareness. We need to build resources that people can get. We need to make people aware of their vascular health and allow them to take ownership in it. And so that's where I'll leave sort of my thoughts around the why, and then we're going to get right into hearing from some of our patients and caregivers.
Thank you so much. And then Mary, can we start with you? What I'm hoping is that we can get an introduction from you, where you can give us some background about your experience and your role as both a patient seeking more information and then giving out more information. And then we're going to go to Ray, and then Kim, and then Dr. O'Banion, and then we'll have a discussion.
Hi, everyone. My name's Mary. I'm a PAD patient and also a member of the PAD Facebook group. It's been about 3 years ago now where I spotted some discoloration on the lower parts of my leg, and that led to some imaging and a final diagnosis of having PAD. I had a complete occlusion in my lower left tibial artery. My vascular specialist at the time really didn't give very much information. He sent me away saying, come back, we'll do some more testing. I'll see you in 3 months, and basically just kind of sent me on my way. And even with having nursing as my background, I understood very little about PAD. It's really just not talked about in the same ways that heart attack and stroke and even muscular dystrophy are talked about. So I came away from that and disappointed, and to learn that there was very little support groups around for those with PAD. I mean, you hear all the time of people who have heart attacks and they've got these support groups, but there was nothing for PAD. So I began a search and was determined to find an answer to my unanswered question of what do I do next? So I had already been a member of the Facebook walking group, and through a link there was led to the PAD Facebook group. And after reading members' stories of their PAD and learning more and more for about 2.5 years, I found the motivation to initiate a challenge towards better health. And thus was born the Move It challenge, which we'll discuss later. It's my nature to want to help people, so I felt that this was the perfect opportunity for me. So I'll leave you with a final thought. For me, finding a PAD community where actions are encouraged for better health and members are supported along the way towards a common goal provides both physical as well as mental health benefits. And this is also in alignment with what I need to be successful in the management of my PAD. I was so grateful to find this group and all these people who have been through something that I am now going through, for me to find information about that I just couldn't get from, as Dr. Conte said, the medical profession sometimes doesn't have the time, or there's a gap there. And I find that belonging to this group and running things like this challenge is filling that gap.
Thanks so much, Mary. For everybody, just for context, there are a few Facebook groups out there that focus on PAD. This is one of them that Mary's referring to, and it's a PAD walking and support group. And again, you can find that information on our website and also reach out to us if you need any more information about that. Ray, I'm wondering if you can give us an introduction into your background, both in terms of diagnosis and reaching out and engagement with different educational materials and support platforms.
Be happy to, Isabel. Thank you. So I guess I consider myself lucky. I used to wrestle in college and play football and coach thereafter, and well into my 50s, early 60s, consider myself pretty active, but got relocated from the East Coast to the Midwest. And, you know, more responsibilities on the job, a lot of sitting, a lot of driving, a lot of train rides. And I guess I kind of lost the old swagger. And the long story short, one day I'm carrying the trash out and my legs were aching. I guess we would call it claudication now, claudication. And it was a term I wasn't familiar with. So about 6 years ago, I had my first intervention. And in 2022, the second intervention where they placed stents. Well, the first time around, as Mary was describing, there really wasn't a great deal of information available. The doctor said, well, you should just walk on a regular basis. Well, I was, but I wasn't getting it. The depth of my knowledge just wasn't very deep. I became a panel member of an outfit called the Society for Vascular Surgery. And one of its members was a fellow by the name of Steve Hamburger. Well, I got onto the website that Steve is a significant part of. And I got to tell you, it became real. It became so much more clear that I had this chronic thing that I needed to take responsibility for. As a result of that, you know, we have some very hot days here in the Midwest. You know, I can't go walking like it's recommended on every day. So we had to develop some alternatives. We had to go to the mall. We had to get into the circulation pool at the Y. We had to try some different options that was going to bring comfort where there was discomfort, you know, with walking. So thankfully, the vascular surgeon that referred me to that group that ultimately put me in touch with Steve, it's kind of a roundabout way of getting the information. And some of the inspiration that I've gotten from the Facebook group, well, as an example, I'll go walking on the Y and the Y indoors, YMCA indoors, and I'll see patients that have their walkers, they're making their way around a track. You know why? Because they know that getting out there and doing something is better than doing nothing at all. So that's an inspiration to me. So whatever I can do to help people, you know, move themselves forward, as Mary talked about her move group, you know, it's a very positive thing for me. So I would just say, I'm a very lucky guy to have found that group because every day there's something new. You don't have to absorb it all, but it's a great resource for moving yourself forward, to keep moving. And it gives you options on things that you may want to pursue and even questions that you may want to take to your doctor with your next visit. So I'll close out with that. I'll just say that, you know, I've gotten some new walking shoes. I'm wearing them out these days. And I'm loving the fact that I'm accountable and excited about, you know, PAD and what its future is for me.
Thanks so much, Ray. I think some of what Ray's talking about is kind of this, what I'm describing as the third space, which is kind of this educational resource, peer support option for patients and caregivers that helps address various wellness activities and recommendations that the provider-patient relationship is promoting. Kim, I'm wondering if you can talk a little bit about your journey, because you have a long journey now with caregiving for your mother, and then also becoming a really active advocate for PAD awareness, and now becoming an active advocate for caregivers as well.
Yes, hello everybody. I'm Kim. I became affiliated with the Foundation of Vascular Cures through being a caregiver for my mother, Gertrude, who was a double amputee as a product of having PAD. My mother, she after she got diagnosed with PAD and had amputations, worked tirelessly to go out and spread the word and give people information about PAD. And Vascular Cures was assisting in that. My mom went to Congress and she told people about PAD. And we also went to a event that Vascular Cures had, and I accompanied my mother. But in doing so and being a caregiver for my mother, and I'm also a nurse by trade, I found that I needed support as well. And in my daily work, I take care of patients, and I'm often giving information to patients and families, and caregivers are involved, and they don't know what PAD is or different diagnoses. I didn't know what PAD was, and I was a nurse in the field. And so it's important that, to me, for caregivers to get support when helping their loved ones as well, because they need to know information about what this disease is. And PAD doesn't get the recognition that cancer and heart attacks and strokes get. There's no real support system out there for PAD patients and caregivers. And I want to take that initiative to maybe bring that to the forefront. And so that's my goal with everything. And I want to do so to also keep up my mom's legacy with the help of Vascular Cures.
Thanks so much, Kim. And we'll talk a little bit more about that later. I want to turn it over now to Dr. Leanne O'Banion, and I'm hoping that you can tell us a little bit about your work with patients and their needs, and also the community outreach piece of the work that you're doing now that's getting so much attention.
Well, thanks for having me, Isabel. You know, it's so interesting. I love listening to patients and caregivers talk. And one of the things I heard from Ray and Mary and Kim was either when I was diagnosed with PAD, or when I had my first intervention, or when my mom lost her legs. But one of the things that was also common was that I didn't really get a lot of information, or my healthcare provider didn't tell me a lot. And, you know, it's interesting. One of the good things that came out of the pandemic was that we had a lot of time to sit around and think. And so I was sitting around and thinking about this, and, you know, like what Kim said, everyone knows what cancer is. Everyone knows what breast cancer is, and everyone knows that you need to get a mammogram to screen for breast cancer. But very few people know what PAD is, and very few people know about all the modifiable risk factors that exist to either halt or limit the progression of PAD. And so when we think about diabetes and hypertension and high cholesterol and obesity, we can modify all of those things, but we have to diagnose them first, and we have to understand their relationship to PAD, and the community and the patients have to understand what PAD is and what they can do to prevent it first. And so I think that was my biggest goal when we started this kind of initiative, was to get out into the communities that were underserved and were socioeconomically disadvantaged, who didn't have the access to care. A little background, I'm from the Central Valley of California, where there's a very limited access to care, especially in the cardiovascular space. So there were rural communities who patients weren't even getting seen by primary care doctors. They didn't know what diabetes was. They didn't know that they had high blood pressure. And so the goal was to get educated physicians and trainees out into the communities and provide testing for these patients, to test them for the risk factors. I don't think the goal was ever to go out in these communities and expect to find people with late stage peripheral artery disease, but to find patients in their own environment, at festivals, at church gatherings, you know, where they were in their community and there was an opportunity to educate them. And I think, even for people like Kim, who doesn't necessarily have PAD, but knows someone who does, maybe a person would come to one of these screening events while they don't have PAD, they might know someone who does. And I think that's where the education piece really comes into play, being able to educate the community so they can potentially take this information back to a family member or a friend. And they're like, oh, maybe they're at risk for PAD and I should talk to them about it. And so I think with the help of Isabel and the Foundation for Vascular Cures, we've done a really good job. We've translated this material into over 10 languages. We've educated communities on all of the risk factors for PAD. We've screened them for all of the risk factors, including, toe brachial indices, which can tell you the degree of PAD or tell you that you don't have PAD yet. And connect them with their community healthcare providers so that they can take this information back to their primary care doctor and say, hey, listen, I got screened. I was given this information. Tell me a little bit more about it. Let me educate myself and my family members so that there's kind of this self-increased awareness in the communities so that they know when to go and see a doctor. So that's, in a short little amount of time, a little bit about what we've been doing.
Thank you so much. I think overall, the picture we're getting is that getting that information, the education out is critically important. And there are lots of different methods of doing that. And it sits alongside and supportive of the doctor-provider relationship with patients. And one of the reasons that we had this webinar was to just sort of talk about resources for newly diagnosed patients, but to Dr. O'Banion's point too, it's there's a screening component and an awareness component to people even knowing about risk. And so it's really about having all of these community resources out there available to people in a variety of ways. As we go forward and sort of find out more information, I thought it would be really nice to go back to Mary, who was talking a little bit about the Move It challenge that she started and kind of get some ideas for people about what that looks like. Again, this is one challenge among many, and there are various awareness campaigns and walking campaigns. But Mary, if you could tell us a little bit about what inspired you to do this, I think that would be really valuable for everybody.
Well, I think, and like hearing people talk about how sometimes it was very difficult to walk, I thought, we've got to keep moving with this PAD. So I thought, well, let's just do a movement challenge. And it's just meant to inspire people to move with whatever they choose to do at their own pace and just to be better than they were before they began. And encourage them to continue to create that new lifestyle habit in the hopes that they will continue to do that long after the challenge ends. And they will get better and do it more frequently, and it's just be better overall for their vascular health. And we thought, we wanted to include everybody at all levels. So how do we do this? Well, sometimes people are just awaiting surgery, or sometimes they're post-op and they can't be a part of a challenge, for movement. But we've posted walking alternatives, so they can do things like maybe chair aerobics or air cycling, or just any kind of alternative to walking, as long as that way they can participate and feel a part of the Move It challenge. And they can and it's no cost or no burden. There's no signups, there's no check-ins. It's basically a you versus you challenge. You want to be better than you were the day before. And we encourage everyone to track their progress so that as time goes on, they can celebrate their improvement.
And Mary, are you finding that people are having a dialogue around how they're doing in this challenge with each other?
I find people are really getting excited. So initially we had someone there, and they weren't able to walk very far at all. And they stated how they were getting depressed and it was hurting and they didn't know what to do. And over the course of about a month, they've increased their walking. They're coming online to going, yes, I reached my goal, and they're getting excited about things that they can do. And some of them have never heard about chair aerobics or air cycling, or some of the alternatives like swimming, which is going to be easier on your joints. They never thought of doing things like that. So they're really grateful for the suggestions being offered. And I find that there's more engagement and discussion going on.
Thanks. One of the things that we've gotten feedback on as a foundation, I'm interested in hearing if you've seen this or if it's consistent with your experience, is that if there's a heavy structure around something, it becomes really hard to execute. And so the easier we can make it in terms of an activity or in terms of material exchange, the more likely it is for success. And that includes kind of dialoguing with other patients and caregivers or people in like situations to kind of figure out how to navigate it, doing a project or understanding materials or so forth.
So we wanted to make it as easy and as simple. And so we encourage even the very slightest bit of progress. A lot of people think, well, if I can only go 15 steps, I'm not going to do that because it's not going to do anything. So we really try to encourage and inspire people to do even just the bare minimum and celebrate that. And I find that inspires them to go then the next day and do a little bit more, because it's like with anything, if you reach a goal, then you want to go a little bit farther.
Thanks. It's really interesting. Ray, I know that you're also doing a lot of movement-inspired activity. And you mentioned having been diagnosed years before you sort of got engaged in activities. Do you want to talk a little bit more about that process? And maybe what the difference is being engaged with other patients or involved in educational activities like you were talking about. You mentioned your work with the SVS as well.
Well, I didn't take it very seriously at first because I didn't realize after the first intervention how serious it could be. And, I'll take part of the responsibility with respect to not delving further into, what this really meant about, my lifestyle. But after my surgeon recommended my engagement with SVS, and then I found the Facebook group, I'll tell you what, I'm out there walking and it allows, I think it helps to stimulate those alternative blood sources down to where I'm having a real problem down to my calves. I'm finding that despite feeling differently on some days, thanks to movement, like move it, I'm working to get out there and to do something different. If it's not a day where I can walk, it's a day where I can go to the gym and actually get on some of the equipment and, try different sources to strengthen my legs. I mean, the way that this move it system has worked for me is that it's just created another whole range of imagination that I can kind of utilize. And there's really no failure. It's about improving upon what happened the day before, charting it, encouraging myself. And there's so many people that are in trouble that didn't know what kind of trouble that they were in, didn't know how deep the water was that they were in. And, I try to be an encouragement to them. But, as Mary stated, it's huge, this website. And I only wish that there was more screening going on so that we could capture people really before they get to a stage. And Dr. referenced how long it may take to get a buildup to a place where you're in trouble and you didn't even know that you were headed for trouble. So this Move It challenge, I'm telling you what, it's a beautiful thing because almost everyone can participate in some way or another. We're kind of meeting them where they are, and they're taking those steps little by little to progress and to improve where they are in terms of their lifestyle. I'm very excited about it, and I will continue to be.
Yeah, that's awesome, Ray. I just wanted to reflect a little bit on, the way you initially presented with your problem versus the way Gertrude initially presented with her problem versus maybe Mary even, and the amount of information you had to process in the beginning, and also the urgency and the stakes at the time that you had to make decisions. So, obviously, it's very, very different when someone first finds out they have PAD when their leg is already in urgent danger, versus when maybe they're just beginning to get the first pain when they walk half a mile, or noticing something about the way it takes longer for them something to heal on their foot, but they aren't actually in trouble yet. And I guess kind of what I'm asking for your input in is, how you would approach that conversation today with your doctor if you were talking about a procedure, understanding that, it's not one of these things that you can just easily just fix with one procedure, one stent or so forth, but it's everything together. How well did you understand that the first time you had a procedure? How differently do you understand it today? And, putting it in the context of total 360 management of your vascular condition. Maybe, Ray, and I want to certainly hear Kim's thoughts about that.
Dr. Conti, I would say, it's 180 degrees different. I didn't really understand where this had come from, nor did they find a cause. I'm not a smoker, there's no history in my family, but there it was. And when I say 180 degrees today, I'm watching my diet. I'm out there doing something every day. I'm trying to inspire others. I'm wondering, after Dr. O'Banion talking about, screening, I'm wondering how we can get more people aware earlier in the process, because I just think that this is so valuable to have folks that are going through certain circumstances that can be avoided, and folks that are going through things that I've been through, or that some of the other folks on our website have been through. It just makes a huge difference to know that there are other people that have been through it. There are other people that are encouraging us, and that there's steps that we can take. So when we start talking about other sources of, when they start talking about, clogged arteries and clogged veins, and that the body can develop other means of blood flow to those troubled areas, that's exciting news to me. And it should be exciting news to other folks. So it's 180 degrees from when I had that initial intervention versus where I'm at now. I'm just so excited that there are things that I can do, that I hope to do, and I hope to live a bit longer in good health, by the way.
It's great.
Kim, I think you're going to jump in there.
Kim, you have some thoughts about that, the challenges of that first conversation, and if it's office, and how you sort of manage the information that you have to deal with?
So with my mother, when we found out that she had PAD, it was an urgent thing. Basically, she was at the end stage, so it wasn't any time to. It was a matter of days. They tried stents, they tried balloons, but it was like within a week, we found out that she needed to have her first leg amputated, and so it wasn't. I'm from a rural area in Mississippi originally. And so it wasn't, no interventions were introduced. And it kind of gets me choked up, because my mom was a retired postmaster. And so she had great insurance and full coverage, but in the area that we lived in, it just wasn't the awareness and there were no vascular specialists. So when she found out that she needed to lose her legs, it was urgent. I knew the doctors, they left that task of telling her that to me because I was working in the ICU. So I personally knew some of the doctors. She was at the hospital where I worked at, which was kind of hard because I took off, and so they left the hardship on the floor, but take care of my mother was more important. But I get kind of upset because she did not get, she went years with wound problems, but nobody talked about vascular problems. So really, it wasn't until after she lost both her legs and we got affiliated with Vascular Cures that I learned a lot about different interventions that had they been introduced earlier would have prevented her from maybe getting an amputation. So yeah, it's a different story from Mary and Ray, but it's our story.
Well, Kim, you mentioned that you're from a rural area, but the Facebook group seems to be covering folks from all over the world. And, it's helpful to be able to relate to folks that don't have immediate or modern or medical facilities that are close by. So I think that's valuable information that you're speaking of,
I agree. And I also, that's another reason why I want to support caregivers, because some people with PAD, they don't have a Facebook page, but their children may. And so where they may be able to get them affiliated with the group, or I may be able to get them affiliated with the group. So I'm pushing hard to just be supportive to patients with PAD and caregivers. That's my goal.
I think
Yeah.
we have a couple of questions in the Q&A that I think it'll be interesting to kind of address and maybe get the perspective of Ray and Mary and Kim, because they've been in these situations. But one of them is, what are the most important questions you should ask your primary care doctor if you're interested in PAD? And I think it's been the consensus that, a lot of people are asking, do I have PAD? But it goes, I think, a little bit beyond just, do I have it? Because sometimes as physicians, I think, Dr. Conti and I can hopefully empathize that sometimes we can get rushed. So it's like, no, you don't have PAD, you're fine. But it's kind of more than that. It's, what is PAD? What are the things that I should look out for that are risk factors for PAD? And what can I do to prevent those from happening? Just like we would educate someone not to smoke because you might get lung cancer, or, go and get a colonoscopy to look for colon cancer. You want to know what things you can do early on in life, because you should start seeing a primary care early on in life. So you can learn about those things, hopefully before they even become an issue, and address them early on and get that risk factor modification. So I think, being an active participant in your care and talking to your primary care doctor about these things, even just going to see a primary care doctor, is important. I don't know if Dr. Conti, you have any other thoughts on that?
Yeah, no, I think you said it. I think especially if you have certain risk factors like diabetes, or you've already had a heart attack or a stroke, you should be getting a thorough vascular examination every year. And so if you're going to your doctor and they're never checking your foot pulses or never even taking off your shoes and socks, or if your questions about your leg symptoms are being written off to aging or some other thing, you should ask, how is my leg circulation? Do I actually have PAD right now, or am I at risk for it? Because, there's a lot to accomplish sometimes in those visits. And, but people have to pay attention to answering your questions. There's another question in there too, I see. Yeah.
Yeah, there's another question. What are the barriers that need to be addressed to support broader accessibility to community screening? I think that's a really interesting question. And I know that Isabel and I have thought a lot about this. And I think it's a little bit of a two-way street, because one, you do have to have an engaged group of physicians in a community nearby that are willing to help. And you need potentially, vascular specialists nearby that are willing to be engaged in the screening opportunities. And nearby, I mean, I've traveled several hours to go to a rural community. So it's certainly, there are vascular specialists throughout the United States that are engaged in this. We just have to find them and talk to them about this program and get them engaged. And then you need community engagement. You have to find those community partners because, like I was talking about earlier, most of the patients and the communities that we're screening don't actively have gangrene on their feet, don't have rest pain or a limb threat. What they have are diabetes, obesity, hypertension, and they need those risk factors modified. And we have to find a way to get them engaged. So like Kim, it would have been great to get your mom access to care and learn about PAD and risk factor modification before it was too late and get that education for her, 20 years before she ended up in the situation that she was in. And that's my hope through these initiatives is that we can provide that to patients in, I'm from rural Louisiana, so I get it, in rural Mississippi and rural Louisiana, in those communities where it's really challenging to get access to care.
And I think I'll just add that Ray sort of highlighted the value of screening from the standpoint of understanding what you're dealing with and managing it. And that's exactly what happens when you're educated and aware. The concern that's always been raised about screening is that it will just lead to more people getting more procedures. The antidote to that is exactly what you articulated, that actually it's the opposite, that if we do it right and we educate people properly, they will need fewer procedures. But the proof's in the pudding. And so I think you can't do one without the other. If you do screening and everybody just gets scared into getting procedures that they might not need, that's a negative outcome. If you do screening, but you're educating people to understand all their choices and understanding, what they, can control, then we should end up with putting ourselves out of business. So that's what our founder wants us to do. But no, seriously, it's really so important that we have all of you on board with that. To advocate for information, not because it's going to lead to, more interventions, but to control the disease yourselves, make good decisions.
And it sounds like part of what we're learning from everybody is the importance of the patient-led piece of this, the caregiver-led piece of this, the community-led piece of this, to get the information out. If we're talking about like barriers to access or some of the experiences that you were describing, Kim, you're not gonna, you may not show up immediately at the right provider is going to give the right information. Some of it gets pushed down to how can you get the information, right? What are the resources that are out there? I'm wondering if we can look at, we have a slide here on resources and information and supports. I will say that there's a lot out there that's available, and it's hard for us here to sort of put all the links up because there really are so many, and it's a very individual choice. But what we did think would be helpful is to talk a little bit here, and please panel weigh in as you see fit around doing some searches ourselves and seeking information. So some of the information might be available at your doctor's offices or in community areas where there are screenings like what Dr. O'Banion is describing. Some of the key terms that might be helpful to look up, and this is for newly diagnosed patients who've actually heard the term, and I think we should also have a conversation about when that doesn't happen, when you don't have the newly diagnosed, but maybe you have some risk factors or some pain. But On the newly diagnosed, just looking up, some terms like what is peripheral artery disease, PAD lifestyle changes. We've actually found on searches, by the way, everybody putting in PAD is really important sometimes as opposed to peripheral artery disease to get the right resources. PAD exercise options, PAD support groups. If you look in Facebook, you'll find several. Supervised exercise therapy near me, leg pain risks. Even, some of the screening tests that we talked about, hypertension and pain, diabetes and pain, some of that will bring up some resources for you. Then can we go to the next slide? And then as you're doing this, one of the things that we found that patients have shared with us and caregivers have shared with us, and some of the advocates who've been really involved in patient engagement work, it's really around like looking at, if you've done a search, can you find out information about the purpose of the website? Like who owns it, who sponsors it? Knowing who pays for it can be important insight into the goal. Thinking about who wrote the information so that you kind of know, is it coming from a healthcare perspective? It's coming from a researcher perspective, a patient perspective, kind of can help orient you to what fits you. Does the website offer quick and easy solutions to your health problems? Like, does it promise a miracle cure? You've heard Dr. Conti talking about how this is a long-term process. And so there are lifestyle changes, and for Dr. O'Banion talk about modifications that are possible, but miracle cures, probably not. And so sort of thinking constructively about what's realistic and again, looking for fit with your style and interests, because we're not the same and it's okay. And so there are different resources out there that may work for different people. I think the big comment that we think is critical and that you've heard from everybody here is that emphasis on looking for those resources and the importance of those resources in addition to the bilateral relationship that you're having with your care team. And then we have a question that came through sort of about, do recently diagnosed patients panic at the thought of amputation instead of focusing on treatment and lifestyle changes? And I think that that's a really great question to ask in the context of really being scared once you get a diagnosis, or frankly, pre-diagnosis and experiencing pain. And so thinking about these searches and the education that's available out there, their support platforms are out there. A big part of their value is to really show the context of possibilities available to patients and to caregivers, and the importance of lifestyle changes as part of that, and supporting the provider space by giving that information and giving mutual support through dialogues between patients, dialogues with caregivers. Would anybody like to add anything to that?
Just aging is a traumatic enough experience, but if you can imagine aging with an amputation, I mean, that should shock or scare the heck out of you, such that it's worthy of changing one's lifestyle. I mean, if that means, okay, I'm going to have pizza once a month instead of, 4 times, this month, or if it means that I'm going to go to the Mediterranean diet instead of over to Burger King or McDonald's, hey, I'm going to do that because, and taking a walk after dinner as opposed to, sitting around on the couch waiting for the next game to come on. Those are important pieces. My doc, and I paid not very much attention early on, Ray, color your plate, meaning, mix the types of foods, get lots of colors, get veggies, get the green fleshy stuff. But unless you're paying attention, unless you see the end game and that potential of how it can hurt you down the road, I mean, we got to take ownership as patients, as prospective patients. I'm a little overweight. obesity is a big deal. Blood pressure is a big deal. Cholesterol is a big deal. And paying attention to those numbers, I think it's all critical.
Thanks, Ray. And then I've heard Mary and Kim say very similar things about, both the ownership piece, but the dialogue with each other around how to support each other in that process.
Yeah, I would like to speak on and touch on that question about, do patients panic when they find out that they have PAD? In my mother's case, like, she panicked because, and it wasn't enough time to panic. I panicked, and it was I just want people to know the importance of how the diagnosis of PAD wears on people's mental, the patient, and having to get an amputation, because the thought of losing your limb is a grieving process. And then the thought of me as a caregiver and my mom losing a limb, and the change in her lifestyle and the change in our lifestyle together was pressing and devastating. So also, PAD is not just a physical problem, it is a mental problem, and that's why I feel like people need the kind of support that maybe we can offer.
Wow.
Thanks, Kim. Really quickly, because I know we're almost out of time, there's a question about the resources that are talked about here, and whether there's specific links to Canada, and for patients, can they access US resources? And one of the reasons that we brought up sort of the general guide on key terms, and sort of also what to be aware of and what to look for, was, to make sure that it was general information that you could use from whatever source you're at. But I do want to point out that, Mary, you are in Canada, and maybe you could talk a little bit about your experience in just accessing resources.
Insofar as when I was diagnosed, they don't do typical screenings of anyone until you actually start to display with some symptoms. And I was fortunate in the fact that I didn't have your typical pain. I was asymptomatic, and I found out my diagnosis quite by accident. And in doing that, I asked the doctor, is there any, because I'm 65, and I asked them, is there any screening that you can do for people? My husband's diabetic. Could he have screening done? No, he can't, just not unless he starts to become symptomatic. So some of the processes are different, and that's just what I found. So.
Thanks. Again, it's a discovery journey, and I think part of our responsibility, we feel, as a foundation, and also the PAD Collaborative, certainly as a number of different organizations coming together with a similar goal, is really to get that information out there to people, from all walks of life, but also all locations. And, that outreach and inclusive piece of it is really critical to, activating people's engagement in their own care, but also helping others navigate through this space. With that, I'm conscious that we're coming in on the hour. I'd really like to thank everybody for their engagement in this process and the webinar, and we're going to send this webinar out again. In terms of follow-up, you can reach out to us as a foundation, and also to the PAD Collaborative. And again, there are lots of different organizations engaged in the PAD Collaborative that are available, and you will see on the website in order to connect you with them. If there's anything that we've talked about here and you would like additional connections to information, we are happy to pass you on to other organizations or other resources too. So just email the info@vascularcures.org, and we'll do that. Again, really, really grateful. Ray, thank you. Mary, thank you. Dr. O'Banion, thank you. Kim, thank you. Dr. Conti, always thank you very much. And thank you to everybody who has listened and all the patients and caregivers out there who are working towards wellness.
Thank you.
You guys.
You.
Thank you.
Bye.